Thank you. It's a pleasure to be here live in Covenant University. I happen to be in Nigeria, and I thought if I'm in Nigeria, I should be here. There's no reason why I should do this from my office or from home. So it's a delight to be here. Please, can I have my slides? I want to stand on the existing protocol. Thank you so much. Right. So I will be talking on the topic sustainable quality improvement in healthcare system. Okay, so I will be talking on sustainable quality, improvements in Africa. And obviously from my introduction, I'm a medical doctor, so I happen to be fortunate to have, practiced medicine here in Africa and also in Europe and in England or in United Kingdom. So I understand both sides of the coin. And on the basis, surely I know that healthcare system, as we put it, a system, is quite complicated. I will try to break it down as much as possible today, so that we will understand what health system is all about and healthcare system. And I will talk us through situations around it that makes it complicated, where we are in Africa and where we ought to be, and things that we can bring into the mix as ingredients that can help us to fine-tune what we need to do. Now, if we are to define a health system, this topic is big. Talking about it in 25 minutes is going to be a bit challenging, but I'm going to run through at a pace that we can gain and understand why we need to change things around our system. So when we talk about healthcare system, I want us to look at it as, if we look at our nation, for instance, I'm in Nigeria at the moment. If we look at Nigeria, there are things that we do as a people that actually results into the kind of health system or the kind of health care that we get. So if we look at it globally, everything that we do and things that actually add on to be part of those things that will give us the results, then we're talking about the health system. Let me just break it a little bit. So things like our weather, for instance, things like our culture, things like our hospitals, things like our healthcare practitioners, all these things, they all work one way or the other to give us a system, which is the health system we're talking about. Now we talk about healthcare system. Healthcare system is a little bit different. It's just a step down from the health system. So you can look at Covenant University, for instance. You have a clinic. So your clinic operates on its own. So there's a system of care that is delivered. So when you talk about the health system, there is a system that actually delivers this health care that we call healthcare system. I hope I make sense from that perspective. Now, any system is quite complicated, and I try to put a picture here. We can see the picture by this slide, where we have the doctors, you have the stethoscope, you have all these things. This whole mix, you can put it together as a form of healthcare system. Okay? Now, a system is anything that works together for a purpose that gives you a result. So you have a combination of activities, structures, all working together to give you a common goal. That is a system. So if we look at it that way, we see that systems are quite complicated. Any system will be very, very complicated because you have my phone making. So you have different bits that come together to form a system. So there is also that bit of the system that interlocks, interconnects, bring things together. So it is not a straightforward thing when we talk about healthcare system. And then when you look at our disposition in Africa, for instance, you look from the north to the south to the east to the west, you realize that we're quite diverse people. We're very diverse in our culture, in the way we do things, and as people. Now, that makes it even more challenging because you then look at a system that is really, really complicated, and you can see why it's so difficult to say that, we look at Africa health system on its own. Of course, there are things that common to us. And I'm going to try and annotate that. Now, for us to talk about healthcare system and to understand it properly, it's important for us to know what we mean by health. What do we mean by the health of a people? And then of a person. And then you see WHO during the Alma Mater Declaration defined health as a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. So it's not like my health is I don't have malaria and I'm healthy. You understand? It's not like I don't have typhoid, I'm healthy. I don't have cholera, I'm healthy. No, it's the totality of all these things that we have to put together, including our social well-being. And then, if we then look at what the declaration was during this, around 1981, WHO actually promised us that by year 2000, we have health for all, that we all have, a good health for all by the year 2000. But are we there? Maybe not. So now, back right from this, then we set another goal. And we said, okay, SDG, Sustainable Development Goal. And then, the African Union also, we came up that by 2063, we have a projection. This is the kind of Africa that we want. And this, since we've been, yesterday I was online throughout to watch all the program yesterday. One thing that is common to all the presentation is this COVID-19 has brought health to the forefront. You understand? So everything that we do, we talk about innovation, we talk about also, but health, our health is at the center of it. So it's important for us to pay attention. And then we now have to look at how, everything interplays. And then, so when we talk about this, what do we really mean? We are setting goals. We set one for 2000, we couldn't meet it. There are SDG goal, you now have series of this, and then we're setting, are we meeting the goals? So we now have to look at our own continent. What are we doing? If we are not achieving the goals we want, what are the things that we're doing that we need to change? And I will say this here, that, you see, it's not that we're not doing things. We have our own health system. We have a system that governs the result that we get in our own, in what we do. But there is a bit of it that we need to pay attention and we need to focus on. And that is, let us do the work. I heard somebody say that yesterday, that, we actually work the work. You understand? It's not about us putting this thing down. It's about us looking at the system. Let's really see how we can change the system. Actively, you and I, we have to be involved, because when we defined health earlier on, we said it clearly. It's not about I'm well. The health system includes you as a people, includes the structure, the infrastructure, and everything. So we have our own bit to do, and then we'll go back, we'll get to that later. And we then think about what does this actually mean to all. We talk about SDG and all these things. There is something at the center of all these development plans and goals that we're setting. There is a commonality, which WHO actually put together. And then we talk, that will lead me on to what we call, the framework of health system. Because it's the framework, which is the concept, our conceptual understanding of what our health system is. And that's been defined by WHO and then the World Health in collaboration with Harvard to form, the building blocks of frameworks. And then we also have the NOB frameworks. Let's just go a little bit. I'm just going to, get into this and then see how far we can go with this one. Now, WHO, they came up with these building blocks, 6 building blocks, things that we think, those are the ingredients that we need to put together for us to be able to achieve a specific goal. There are so many frameworks. I've just pulled these two so that we can just have a look, because most of those goals, they have a common, there's a kind of common factor to all of them. And then we can tease that out in these two framework. So as a people, how do we deliver our healthcare service? How do we deliver the healthcare service? If you look at Nigeria, for instance, which I'm going to be using as a point of reference, because that's where I understand in Africa. If you look at, and whatever operates in Nigeria, operates in quite a lot of African countries. And we will see the reason. And that's why our people run away to, they will go to India, go to America, go to whatever. Once they have headaches more and they have the money, oh, I'm going. Because of the quality that we're delivering. People believe that we don't have that quality that they can get abroad. So the quality, what we then signpost us to what the qualities are, will be how do we deliver our service? You understand? So service delivery, the health workers, what is the attitude of the health workers? How savvy are they? How effective are they? You know, all these things. And then you talk about information, the information governance. How robust is it in our system? You understand? Then we go to things like the medical products, vaccination technology. Medical products, you look at, you know, how easily do you get fake things in Nigeria? The quality assurance. You understand? The control that we have in place, the vaccines, our coaching system, all these things all together. Technology. I heard the previous, speakers today talking about technology. Technology is something that is key, especially in a population that is massive, like what we have in Africa, where we cannot actually reach out to our people. We should leverage on technology. We have a project, Area Doc, that we do, an app that I launched sometimes this year, which that has given a lot of people who do not even have the opportunity to get access to health. So then we talk about financing. How is our health system financed? Is it individual finance, out of financing, out of pocket financing, where people come and pay, which is what is robust here? Capitalism sort of, financing in Africa. How effective is that? When we compare that to a public financing, whether the government is through taxation, like we have in the UK, we have NHS. Thankfully for NHS in the UK, we use national insurance to run our insurance system. So everybody gets the care that they need at a price. So we look at all these things. How are we set to deliver these things in Africa? Then leadership and governance. This is really key, and it touches my heart each time I look at this. Leadership, and that's where education comes into play. The people driving the vehicle in health sector, not only in health sector, this also called across other sectors. How are they delivering things? We talk about corruption. We talk about, attitude. We talk about, there's so many things that is still part of this system that we're talking about. If you have hospitals, they have fund for to deliver care. How do we manage this? How our leaders, how are they handling that? How does that trickle down to an individual? Because in the end, it comes down to you. What can you achieve? What can you get from the system that you're in? So all these things together, then we look at it as, if we look at how this is delivered, then the overall goal will be, we want to improve healthcare. We want a responsive healthcare. You want a social and financial, risk-free healthcare, and then improved efficiency. All these things, I'm going to try and see whether I can just bullet some points on things that we should be doing for us to make sure that we're gaining well from whatever service that we have. So this is what WHO put down. And in the middle of this is talk about all these services. For us to get this goal, how accessible are the services? What is the coverage like? What is the quality of the service that we're delivering? And how safe is the healthcare service? Now, healthcare service that we deliver. This was in 2007. Guess what? There were a lot of criticism around that, framework. And then people said, the framework does not show how this is patient-centered. How does this apply to me? And then there's no interconnectivity amongst these factors. So this was rebranded, I think, in 2010 or so, 2009, and then we came up with this, which then shows that there's a kind of linkage between all these factors, all these building blocks, and then people is at the center of it. It's what you're able to get as an individual, as a people in this. And then this is what the WHO is quite similar to the previous one. So it's talk about financing, payment, organization, regulation. Regulation is key. How do we regulate our practitioners, our nurses, our doctors? the body that regulates, how efficient are they? How survey are they? So this way we can expand and contrast this thing to then see the result that we're getting from the other side, in terms of all those knobs. And then they gave us, the target, which is like, again, the goal, health, status of individual or the population. Then the customer satisfaction and risk prevention. Now, you would then ask that, where does quality come in the mix of all these things? Yeah? Does quality just mean that you do your best and I do my best? Are we jumping a hoop? You're jumping from one, I'm jumping, you jump yours, I jump mine. And I think that's what we've been doing. Is it really working for us? So let's then look at the distribution. Let's see how this is distributed in terms of the global distribution of overall efficiency, which is what shows how efficient our system is. So if you come to this now, let's go. Now, if you look at that is Africa for us. Look at what we're having. Our record is showing that we're not actually there. There's so many. And this cut across the whole of Africa, unless if you're looking at the northern part, which is a bit green, look at the other bit. With majority of what we're doing in Africa at the moment is quite below. And how did we arrive at this? So you then ask, were we sleeping? Is it like a puzzle we're confused, battered, unclear about what we're doing? So what are we doing wrong? So then we have to look at, our own situation as a people. How can we improve what we're doing? And then I try to look at everything, and I see in the mix of it, when you look at what actually determines the quality that we're getting, yes, the system is there. Yes, we have the people there. Then you have these health sectors, the health sectors. You have people, the admin or the administration that is actually governing this. The financing, they're all there. But of importance is leadership issue. Leadership issue is big in the reason why we're not achieving what we need to achieve. We need a visionary leader. We need visionary leaders who can then see where they want us to go. And it's not about talking. We talk too much in Africa. We talk, but we do less. We keep having meetings, keep writing papers. We're not getting results. Are we reviewing what we're doing? We need to be there, reviewing it, making sure that what we're doing is actually working. If it's not working, let's take a feedback loop, learn, kind of a loop system, whereby, you learn, you change, you move. That's the only way. And then we're a people, our culture is different from the culture in the Western world. What we're doing in a different stage of, when you go from north to south of Africa, we're just completely different. Everybody needs to know that they need to protect their own thing. You understand? Like in Europe, if I practice in England, if I go to France, it's so different. You understand? They have learned to know their own system, and they keep changing. I told somebody, I've been out of the country in the UK for some time now because of this lockdown thing, and then I'm thinking, if I go back home now, I need to actually, start learning what has happened, because every day things change. Things change and we keep moving. But we stay here and we watch things change. We run and catch it. By the time we're catching it, things has gone. So we need to be driven by innovation. We need to be driven by education. We need to be driven by technology. We need to be in there to get our hands dirty. So if you look at our culture, it's different. Our value is different. And we have to walk the walk. We just have to do it. Nobody's going to do it for us. Do you understand? And then, look at the ratio of doctors to patients in Africa. I looked at the whole of Africa. The level is so strange, because the range is so wide that we can't actually deliver the service. And it's one of the main things that is bringing us down as being, poor in that of quality that we're delivering. Infrastructure, I said that earlier on, in terms of infrastructure is not something that just dropped from the heaven. I went through this. I have the opportunity the second time to go through Covenant University because I have a sister here. And then, I mean, it's amazing. Look at the infrastructure that is here. You understand? And I'll show you an example of an hospital that I worked with. And then the way we've turned things around in Nigeria, where people think it's not possible, within 6 weeks. You understand? So if we have the vision, we can do it. And there's no reason why we can't. You understand? So infrastructure is important. We need to work on an infrastructure. We need to find a way of funding this and financing it. Health inequality, the social class, the distance is so wide here. It's something that we need to find a way of breaching. And then you see all these things we're talking about. If you look at the bottom of it, the bedrock of things that need changing is education. Education, education, education. Why are people, if you see the way doctors relate to patients here, the way things happen, isn't it the need for us to educate our people and also educate our doctors? Ethics is out of the roof here when it comes to the way you do things. You don't even internalize things and empathize with somebody in front of you that you could have been the patient. Do you understand? So we play God sometimes, but it doesn't work that way. And these things need to be driven from our curriculum changing. Because when I practiced in Nigeria before I went to Ireland to do my postgraduate degrees in tropical medicine, there are certain things I did not know. I told my wife is a pharmacist, and I told her, and I said, look, I think something is strange. I think I've been doing the wrong thing in Nigeria. Throughout the practice I was practicing, I only did a postgraduate diploma in tropical medicine. I realized everything is that malaria and typhoid, the malaria and typhoid in those days, malaria and typhoid. But when I got there, I realized there is more to it than malaria and typhoid. You understand? So even though we learned so much, but when it comes to point of delivery, there is something that is skewed. So we need to go into what is important for us. What do we need? In our education, it's not about cramming Pythagoras theory. Do you understand? It's about us learning things that is relevant to what we need to deliver. And that's targeting the quality that we need to deliver. So education is quite key to that. And that's why I put education, ethics, communication. Communication is no way. I saw some consultants some days here, and the way they were talking to the patient, I had to wow, you can talk to me like that, man. It's just appalling. And then we need to work on the communication. We need to work about our clinical governance, errors. The error happens, we don't investigate it, talk less of changing the system. It happens again. It happens again. Unfortunately, I lost my father to that in this country. Do you understand? Because somebody prescribed a medication to give the medication to my father. They gave a completely different medication. The man was taking it. He called me and said, take your medicine, you'll be fine. Not knowing that the man was taking the medication that was going to kill him and end his life. So that's his thing. And those kind of a thing, I don't think has even changed. It's still there, because what you do is you do analysis of such error and prevent it happening. In our system, we don't have robust things like this. We need to start thinking and looking at things like that. So, and then we have to be systematic and strategic in our approach. We need to know we're going from point A to point B, point C. How do we get there? We need to sit down, maybe annually, maybe as a health, even here in your healthcare system, you need to sit down, know what you need to deliver. It's only when we start doing it, like I said earlier on, the system is multinodular. So if you look at those nodes, everybody needs to do their own part. You need to do your own part. All of us need to do our own part, and it cuts across the whole continent. So learn, feedback, learn, and change. We need to put that robustly in our system. So together, we can put the piece together. We just have to do it together. It has to be a continuous thing. It's not something that we're going to do and then we say, okay, finish. Like it's a continuous process. And that's why what I was saying earlier on, the process of a system keeps changing. If you have a system that I'm there today, I'm from Kwara State, and I traveled home recently to go and see my mom. And when I went to one of the villages that I hail from, and I told my brother, I called them in the state, I said, look, those potholes that we saw when we were growing up 30 years ago, they're still there at the same spot on my way to Omaro. Actually, those potholes, I could almost mark them that this spot, I remember it, that one, I remember it. And I mean it. So a system that is not changing. Do you understand? It's quite appalling. We need a continuous change that will drive our system. These are a set of things that I think we need to carry as as a kind of toolkit for quality assurance. We need to have standard. We need to have clinical governance, like I said earlier on. We have to have our guidelines. We need to have our SOPs, you understand, of things, so that everybody is doing the same thing. If I'm in England and then somebody said he's got chest pain, I'm comfortable that what I'm going to do in the Midlands is what somebody would do in London. It's because we have a guideline, a system that is working, communicating things effectively among the system. So people, we're all doing the same thing. It's not like, oh, this one you have given A, that one is given B. B is better than A. The most important thing is this person, are they getting better or not? Do you understand? These are the things that we're missing in our system. So we need to know how to audit. Auditing means that you have a standard. You're checking the standard. Is it matching up or not? Things are matching up, but they're not matching up. And then we keep moving from there. And then we have all these things. Everything should be evidence-based. We need quality assurance, visiting and things like that. Key performance indicators. And, training. As you're pushing this across, you're also training people to be able to deliver an effective activities and system. There's a lot to say around this, but the time is not going to permit us now. So the thing is, it is actually doable, because we can think, oh, the heaven is falling on us now, or the whole world is crumbling. No, it's just us having the vision. And the reason why I said this is an hospital that I got involved with in terms of changing the healthcare system in the Federal Medical Center, Butemeta. And a lot of us would have had this. Everybody is praising this hospital now. The system started by a leader that is visionary. The MD of the hospital is so visionary. He called me and then we sat down and said, I want my hospital to be like your hospital in England. And then we started ruminating. It was just like a small thing that started. Now it's big. The system is one that can ask people to go and look at. From here, we go to there. Okay? Then from here, we go to here. You won't believe you're actually in Nigeria when you walk into that hospital. They took me there. I was like, this is an hospital? I was almost can't even walk. And then we turned it to be something like this. Do you understand? So there's been a lot. And then this is not only it. Also, we talk about the system. The system will mean you have the hardware and the software. So I told them we need to do a lot of training. Training. We're doing a lot of training in the hospital, changing people's mind, changing culture, moving things forward. And things are changing. I think there was a reporter or two reporters that went to the hospital. They went anonymously, and then they put something on the website, on the internet, how efficient that hospital is. I thought, look, this is one that we can actually look at. And this is something that this particular change happened within 6 weeks. Believe it or not, within 6 weeks this happened. So if you have a vision, a visionary leader, and then we all have to put our hand on deck. It wasn't that straightforward or easy, but resilience and, working together, being prepared to do it, carrying everybody along, educating them, training them, letting them know the right thing is what has actually changed. And then we have other things that we've done, like all this breast screening thing that we're doing in the country, trying to change the system. Putting a structure in place where we reduce things. So you have your own bit, I have my own bit to do. And I hope I've actually been able to talk you through all this. And I really appreciate the opportunity to be here. I really thank the visionary of this whole system, because it's a system on its own. When you look at CU and then, the environment around, I want to thank our father, Dr. Bishop Oyedepo, for all he has done to make this happen. Thank you so much for having me. It's a great pleasure to be here. Thank you.